The nasal chamber. Now we'll continue with the next part called as the pharynx, by means of a pair or sometimes one nostril or opening called as internal nares. This internal nares, as we mentioned, it could be either 1 or 2 in number. They are oval openings generally seen communicating between nasal chamber with that of the pharynx. These openings are bounded by means of semicircular soft muscles, and these muscles are generally referred as uvula. This uvula helps in closure of the opening of internal nares at the time of swallowing of food by the animal. Otherwise, the food particles will enter into the chamber of nasal cavity. So to prevent it, uvula helps in closure of the internal nares. The next part it continues with is the pharynx. Pharynx is a short tube which is a common tube for the inflow of food as well as the air. It is a conical chamber which is divided into 3 parts. The part 1 is to its anterior side attached to the internal nair region called as nasopharynx. So this portion of pharynx is called as nasopharynx. The next pharynx portion is attached to the buccal cavity or mouth cavity. This is called as the buccal cavity associated pharynx, referred as oropharynx. Oro refers to buccal cavity. And the lower pharynx, which is attached to the posterior side with the larynx, is called as laryngopharynx. The speciality of laryngopharynx is that it shows the opening of the opening of the larynx is seen with an oval opening called as glottis. Glottis is covered with the special kind of cartilage referred as epiglottis. So epiglottis is a flap of muscle seen at the apical region of the cavity of glottis. So down the pharynx at posterior region is the larynx, and there is a median opening called glottis, and the glottis will have towards one side the presence of a flap of cartilage. The cartilage will close the glottis whenever the food enters into the esophagus. When you look at here in this diagram, this is the opening of the pharynx into the region of windpipe or larynx, windpipe in the larynx, whereas the same pharynx towards the other side opens into the esophagus. That's the reason why we said it's a common passage for the food and the air. Whenever food enters into the pharynx, food is made to move into the esophagus, and there is a closure of this particular pipe with the help of epiglottis muscle. Then epiglottis will now continue with the structure called as larynx. Larynx is commonly called as the voice box organ in case of the animals. It helps in production of sound or resonation. It is externally covered with muscles and cartilages. The cartilages it includes in case of mammals includes arytenoid cartilage, cricoid cartilage, thyroid cartilages, etc. In case of man, that is male organisms of mammals, of human beings, we find the thyroid cartilage of both the sides joints ventrally to have a protrusion near the throat, and this protrusion is called as pomum adami, and it is also commonly called as Adam's apple. So you find generally Adam's apple or pomum adami in males, which is a protrusion of the thyroid cartilage at the ventral location. So inside of this larynx, we have 2 pairs of vocal cords. Vocal cords are special kind of muscles which are internally supported by bony cartilageous structure. And these 2 pairs of vocal cords are called, one pair is seen towards anterior side, upper side, one pair towards posterior side, localized at the parallel location. Anterior pair of vocal cords are non-functional, whereas posterior pair of vocal cords are functional. The vibrations of these folds helps in the production of the sound during expiration. Whenever we expel out the air from the lungs, they will help in the vibration of this posterior vocal cords, leading to the formation of the voices. Generally, vocal cords in case of males are said to be thicker than the females, and it is larger in case of males and they are shorter in case of females. So that's about the importance of the larynx.
3.
Larynx leads down at posterior side into a median tube called as